Okay, do you want me to start, Georgia?
Yes, go ahead.
Okay. First of all, thank you for inviting me to give this presentation. This is the second time. As you know, I gave it, I guess, last month up at the Oakmont Progressive Democrats, and it was very well received. So we'll try it again and see what you guys think. I thought before I get into the Medicare Advantage programs, we better review a little bit about Medicare or CMS, which is what it's called. You probably all know that you have Part A, which pays for your hospital. This comes out of the Medicare Trust, which is funded by all of our payroll taxes, which were taken out of our pay every 2 weeks. And as you can see there, the rate presently is 1.45% from the employee, and then our employer would pay 1.45%. So this is the funding or the area of money that's called the Medicare Trust. You'll see that written up as such in some of the articles. Then Part B pays for physician and most outpatient services. And this is funded by a deduction from your monthly Social Security check, and also from some of the taxes in the general fund. Now, this is dependent, the amount that would be taken out of Social Security is dependent on what your retirement income is. So it could be adjusted. Not everybody gets the same deduction. And then Part C is really Medicare Advantage programs, and this began in 1999. And then Part D, which covers your medication or drug coverage, was implemented in 2006. Now, going back to traditional Medicare, which is what I have, it pays 80% of what it considers usual and customary charges for a specific geographic area. So what's paid for here in Sonoma would not be the same that people up in Amador County would be getting paid, the Medicare Advantage program. So it's based on a geographic area. So Medicare pays this 80%, and then the beneficiary is left with the 20%, or you can get a supplemental insurance plan that will pay that 20%. Now, for this year, CMS said that for the Part A hospital, there is a deductible of $1,600. And for Part B, there's a deductible for $226 for the year. And one of the complaints about traditional Medicare is that there's no out-of-pocket limit at this time for people that are in traditional Medicare. Now, just a couple of facts about healthcare here in California. I believe this was the amount for 2021. California spends $517 billion on healthcare. The Medicare Advantage out-of-pocket limit, and this comes from Medicare, for this year is $8,300. So if you are in an Advantage program, Medicare says you don't have to pay more than $8,300 a year, which I think is a pretty high limit. Now, Medicare Part D for this year, 2023, again, this takes care of the drugs. There is a deductible, so you would have to pay the first $505, or maybe your Medicare Advantage says you don't have to pay anything, but ones that do pay or require you to pay, they can't charge more than $505. Again, the Medicare Part D has income-related adjustments. So depending on what your retirement income is, your fees might be higher or lower. The drug program has initial coverage of $4,660. And I'll tell you, this is kind of complicated. I'm kind of glad I don't have it. Then you go into what they call the donut hole, where you pay 25% for all your meds. And then when you've paid a total of $7,400, you move into catastrophic coverage. And the catastrophic coverage then drops down in price to $4.15 for a generic and $10.35 per month for a brand name drug. Now, under the Inflation Reduction Act, this is going to change in 2024. There'll be no charge during the catastrophic period. And in 2025, the out-of-pocket cap will be $2,000 in some programs excluding the premiums. So we've had some benefit, or people have had some benefit under the Inflation Reduction Act that was passed this year. Now, some good things about Medicare Advantage. First of all, you can have low or no monthly premiums, which a lot of people are attracted to that. It may include fitness memberships, and this is a marketing ploy because they figure if you can go for fitness, you're going to be a pretty healthy senior. It may include coverage for vision, dental, and hearing. A lot of them do. And program has a network of primary care and specialists, and usually has a computerized medical record to share patient data among physicians. One of the reasons that Medicare Advantage was instituted, it was felt that in traditional Medicare, patients would go to different doctors. There wasn't a common data set for the patient. Some tests would have to be repeated, which was an unnecessary cost. So the computerized medical record is an important feature. And then some of these programs may include drug coverage and some don't. You have to get that separately. So what I did was go in to find out what programs are available here in Sonoma County for 2023. And this is the first one that came up. I think there were 5 altogether that came up when I did my search. So what I want to do is run through this Kaiser Senior Advantage Basic that is available in this year in Sonoma. So this, again, very nice. There's no premium. You do have a copay for your regular doctor of $5, specialty $15. They have a dental, hearing, and vision copay, which you can see there. They'll give you $150 towards your glasses every 2 years. That's nice, but the last time I had to buy glasses, it was close to $400 for a pair of glasses. So in this program, you'd have to make up the difference. If you go to the ER, your copay is $110. If you use an ambulance, you have to pay $200 copay. Now, in-network out-of-pocket limit is $6,000 in this program. You remember Medicare said they can't charge you more than $8,300. So this Kaiser Senior Advantage Basic has a lower limit of out-of-pocket. So I think that might be attractive to a lot of people. But it doesn't include the meds. That's a separate thing. And I could not find, in fact, this is what was on the 8 pages that I printed out. If you go out of network, this was all that I could find on the paper. It said not applicable. So I don't know if that means if you go out of network, you're entirely on your own. I'm not sure what that indicates. Now, if you have ambulatory surgery under this program, you have to pay $240. If you have advanced imaging like an MRI, you would have to pay $210. Now, for hearing aids, they will give you $1,250 every 3 years for your hearing aid or an upgrade. And if you have to be hospitalized, you would pay $250 a day for 5 days for hospitalization. Now, here is their drug plan. And before, when I looked at some of these, they only had 4 tiers. Now they've gotten to 6, and you can see how they break this down. Preferred generic, that means on their formulary for this program, the drugs that they consider generic, you don't have to pay for them. If you have other generics that aren't on their formulary, you would have to pay $12 for the prescription, $45 if you're preferred brand, $100 for non-preferred brand, and specialty tier 5. This is really the expensive drugs, and these would be your medications for chemotherapy, and especially some drugs that are used for rheumatoid arthritis that can be very, very expensive. And in this program, you would have to pay 30% of the cost of those drugs. And then they added vaccines as a tier 6, and they are all free, which is very nice. Now, it says that the out-of-pocket limit in this plan is $4,660. But that's for both you and what the plan pays for these drugs. So it's kind of hard to determine before you go in, what you might have to pay. Okay, they do provide other services under this basic plan. You can get home delivered meals, but only if you've been in the hospital for congestive heart failure and only 4 weeks. No other diagnosis would give you that benefit. And then they have a catalog for over-the-counter health and wellness products, and they would give you $60 every quarter if you wanted to purchase from that catalog. And then they do offer discounts. Lively Mobile Plus, this is one of these emergency response where you wear something around your neck. You would get a discount on that. You also would get a discount from Comfort Keepers, which is in-home care and assistance, and also on a mom's meal. I really don't know anything about either of those entities. Okay, now traditional Medicare. This is what I have, so I'm telling you what I pay. And the reason that I decided to go with traditional Medicare when I became 65 was that I wanted to be able to go to any doctor or hospital in the United States. So if I have a problem that is specially taken care of at the Mayo Clinic, I could go there, and both Medicare and my supplemental insurance would pay for this. So for my Medicare Part B, again, this is doctor and other services outpatient, I have $148 deducted from my Social Security check every month. And my supplemental insurance with United is $252. Now, the other thing you need to know about supplemental, when I got this, when I became 65, I went to the highest level because if you look at these programs, they all have 3 or 4 different programs. So I went to the highest, which was good because they do have requirements that if you start out with a lower program, you cannot then upgrade to the higher one, which would pay more. You can only go down in the programs that would be offered by United Healthcare. So anyway, for me, the fixed cost was $4,812. Now, I'm pretty healthy. I did not get the medication program when I went on Medicare because the only thing I was taking was a baby aspirin. So I didn't think it was worth it for me, and I'm glad I didn't. The other thing that is a problem that I see with the drug programs is that if you do not go into a drug program when you are going into Medicare, they charge you a fee for not going in right away. And it's not a one-time fee. That fee is added to your premium for that program every month. So a lot of people complain about that, which I think is an appropriate complaint for the program. Now, how does the Advantage program get paid? Well, this gets kind of complicated, but I'll walk you through it. They start out with a capitated payment, and they do have a 5-star rating. And if your program is in the 5 stars, you would get a little more than the usual. Now, how do they determine what you're going to get? The capitation payment is usually by county. If a county, say Amador doesn't have enough people, they might put a couple counties together by region. But what they do is take a population like me of traditional Medicare patients, and they see what has been spent on that population the previous year. And then they ask these Advantage plans to bid on what they think they could provide the care to a population in their program. So say 100 is what's used to take care of the traditional Medicare in Sonoma. Well, a lot of these programs would then bid, say, oh, we can do that for 85 rather than the 100. And they say, oh, great, okay, you're going to do that. And then, of course, they see what they do. If they really come in at 85, then they've saved Medicare 20, obviously, let's say 20,000. But the way it's set up, the Advantage program will get a big part of that 20,000. So they haven't really saved a lot of money. And you'll see on further slides that they really haven't saved any money for Medicare. So you would have a capitation payment, and for Sonoma, I think it's now, when I last looked for this year, it's about 1,100 a month is paid to an Advantage program in Sonoma, independent of how often that patient is seen or what procedures it has. That is your basics. And then the Medicare Part B, you still have to pay the deduction from your Social Security for Part B. Remember, you've already paid for Part A when you were working. That's in the Medicare Trust. And then plus you're going to have monthly premiums, maybe you won't have a monthly premium, but you're also going to have a drug program, and that can vary in what that's going to cost you. And then the big thing is all those copays that we went through for that basic Kaiser program. So it can add up to a significant amount that is being paid to take care of you. Okay, there's a new entity just coming up in the news called the Pharmacy Benefit Managers. And this is a person that would usually work for your insurance plan. And they go to the drug manufacturers and do a deal to see that they can get reduced prices for that. They're representing the health plan, so the health plan is paying them. And then they go to the pharmacy and see if they can do a deal with the pharmacies. And of course, if they can, they get paid from there. So if you're in a health plan in Sonoma, you might be told that you can only get your medicines at CVS, or you can only get them Safeway, or wherever this pharmacy benefit manager has done the deal for your insurance program. Right now, Senator Sanders' Help Committee, which is Health, Employment, Labor, and Pensions, is looking into these pharmacy benefit managers and what they're doing to increase the cost of medication for all Medicare beneficiaries. Now, I have progressed since my one baby aspirin a day. I now take a blood pressure pill and a statin for elevated cholesterol. But, and I'm a cash customer because I don't have any insurance for my drugs. So here's the story with this, which I just discovered recently. Back in 2006, Walmart decided to offer certain drugs at $4 for a 30-day supply. Now, this is quite a few years ago, but all the other pharmacies said, oh my heavens, we have to decrease our cash price to be competitive, which they did. But all of these pharmacies have to report yearly to CMS what they're charging as their usual price. So Safeway was charging $10 for a 90-day supply, and this is up until 2012. But they reported to Medicare that their usual and customary price was $80 to $109. So that's what they were getting reimbursed when they were only charging $10. And there were some whistleblowers that reported this overcharge, as you can see. An appeals court, when it first went to court in 21, said that Safeway not knowingly violated the False Claims Act, which is kind of strange. But then that wasn't the end of it, because 33 states, the feds, Senator Grassley, are taking it, have appealed, and it's going to go to the Supreme Court, and there will be a decision expected by the end of this summer. So that's where my Safeway drug place is right now. Okay, this is where I get my insurance, United Health Group. So I sort of follow them along. I don't follow all these other ones. I figured this is mine. Now, United Health only does healthcare insurance. They don't do house insurance, life insurance, car insurance. They just do health. And this is the profit that I've been following since 2020. And I think you could say they're doing okay. They've already gotten $5.6 billion for the first quarter of 2023. Their share price has gone up. In April, it was, I think, at its highest at $515.18. Now, there are a couple parts of United Health Group. First of all, there's the insurance, and then there's what they call Optum. Insurance can be sold to employers for employees. The Medicare supplement, which is what I have, They also run Medicare Advantage programs. They also run programs for Medicaid, and they have insurance. If you're a big traveler around the world, they'll give you a health insurance that will pay for wherever you are when you get sick. Then Optum has 3 divisions to it. Optum Health is buying up medical practices. In fact, I've gotten some emails from them wanting to know if I'd be interested in joining one of their medical practices. The Insight division has data systems that they will provide doctors in their office and also do a lot of consultants. And then they have Optum RX, which is their pharmacy benefit manager and pharmacy program. So they really cover all areas of healthcare delivery there. Okay, now this sort of shows you the difference in their millions or the money they make. Right now, I'm on the red line because I have private supplemental insurance from United Healthcare. But if I was in an Advantage program, do you see the green line? That's Medicare Advantage. And you can see where they're making most of their money. And the orange line is where their programs, they have that supply care to Medicaid. That's going up too, but certainly the Medicare Advantage programs are where they're making most of their money. Okay, I got tired of looking at the billions. I'm not going to spend a lot of time on this, but this Wendell Potter, when he evaluates it, he says percentage increase in their revenue, their profit, their revenue from Advantage. And you can just look at the Optum, the benefit manager, pharmacy benefit manager is really giving them the most profit right now from that program, our Optum RX. And the other thing that they're doing, which a lot of these big for-profit companies are, they're buying back their stock with a lot of their profits because if there's fewer stocks available to buy, their price goes up. And their stock price has gone up 1,800% since 2010. So you can see where all these dollars are going. Okay, now the case against copays. When they were first talked about back in 1970, Rand did an experiment. They said, oh, this would be great. If you just charge a little copay, people won't abuse healthcare services. They won't get things that they really don't need, and it won't cause any problems. That was back in 1970. In 21, Berkeley and Harvard did a study which showed that a $10 can be a matter of life and death, as you see here. That would be a 34% increase in the drug price. It led to significant decrease in patients filling their prescriptions. And eventually they followed this and they found a 33% increase in mortality. So these people who couldn't afford their medicines were actually dying. And the most really sad thing about this, that it was patients that had the greatest treatable diseases. We know how to treat heart disease, hypertension, asthma, and diabetes. And these were the people that could not afford their medicine. I think you've also read a lot in the paper about the price of insulin. And they're finally doing something about that they're going to reduce the price of insulin for seniors, which is great. Okay, so what could be done about this? Well, the government could say, okay, well, let's limit the cost sharing. But they're trying to do that. But you saw what the cost sharing was. You know, it can be up to $8,000. That's really not going to take care of the problem. Or they could eliminate this program altogether and go to Medicare for all, which I think is really the only answer for our healthcare system. So again, just as I said in the beginning, Medicare has put a limit on out-of-pocket expenses and Advantage programs, but $8,300. I think that's a pretty high limit. And then these programs, you really have to look at them because they can all vary in what they count as out-of-pocket expenses. So you might think you're going into a program where something is covered and it may not be. Okay, now here's my read on Medicare Advantage plans. There's too many, they're too different, they're too complicated. People can't understand them. They may not have adequate numbers of doctors in a specialty that you need. They want healthy seniors. That's who they're going after because that's where they make the most money. And a plan can change their doctors or services yearly. So your medication, if you're in this plan, may go from a tier 3 to a tier 4 automatically when they decide to change it, which could mean a difference between $45 for your prescription to $100. And their risk adjustment system, which is known as upcoding, is ripping off Medicare. And this is being done by all these Medicare Advantage programs. So I want to tell you a little bit about that. Okay, we talked about the capitated monthly payment for here in Sonoma, it's $1,100. And the benchmark would be related to what it would cost to take care of a group of traditional Medicare people like me for the geographic area, which would be Sonoma. Then the Medicare Advantage plan will bid against the benchmark. They get the bonus payment if they perform below the benchmark. Remember, we said the benchmark is 100, they bid for 80, they perform at 80, that 20 that's between them as a savings, and they're going to get some of it back. But the real way they make their money is through the risk adjustment upcoding. And this is based on their complaint that our patients are sicker, so we need more money. And it's determined by diagnoses that are put with the bill to Medicare. Now they have a quality rating, a 5-star system. I did mention it previously, but if you all remember Lake Wobegon, remember when they said all the children were above normal? Well, with this 5-star system, it's sort of like that. All the programs are either 4 or 5-star, and they all get extra quality rating money. And these 4 payments are all additive. So you can see where it could get rather impressive. Now here's a, this slide is a couple years old. I got it from physicians from a national health program. But you look at the typical coding, there's a score, and you get it for your age, your sex, and then it's based on your diagnosis. And if you go through down the bottom of that first score, you can see the Medicare annual payment on that patient would be $9,000. Now, right now, it would be at least $11,000 for the year in Sonoma. But if there's upcoding, and you can see if you have diabetes and they put with retinopathy, that means they look in your eyes and they can see changes in the vessels in your eyes, it would increase your score. If you have asthma, here you had no score, but if they say COPD instead, the score goes up 0.328. With the result, the bottom there, this with upcoding, instead of the $9,000 that they would get in this particular instance, they would get $32,000 to pay for care for this patient. So this is what upcoding is. Now, this is, let's see where this came from MedPAC, which I'm going to talk about in a minute. But this is what it is generating from 2007 to this year. 124 billion in excess payments by Medicare to these Medicare Advantage programs. And you can see the big increase in 2022 and 2023. Now, this has finally gotten some attention from the media. And starting in January, I believe there were a series of 3 articles in the New York Times about upcoding. And this was one of them. It said the cash monster was insatiable, how insurers exploited Medicare for billions of dollars. Now, this is another way to show you traditional Medicare has a very low overhead, 2%. So 98 cents of every dollar goes to patient care. And the Medicare Advantage program, when it was set up, the programs were allowed to keep overhead and profits of 15%. So 85 cents of every dollar would go to patient care. And there's a new program started just in January where it can go up to 25% or more. And so these insurance companies, especially Wall Street, wants to get into these programs because the ability to make money is unbelievable. Now, MedPAC, as I think I mentioned before, it's the Medicare Payment Advisory Commission. It was set up by Congress to evaluate Medicare, keep tabs on it, and report back to Congress how they were doing. So this is their 2020 report. And the first statement there was that, hey, Medicare is paying $15.38 more per beneficiary than they would have spent on the same patient that is in traditional Medicare. Wake up, wake up. This resulted in $12 billion in overpayments. And they make the statement that Medicare Advantage have never produced savings for Medicare. And it's because they have a deeply flawed payment rate, and this risk adjustment upcoding is what we just talked about. And they are worried that continued overpayment is going to worsen the fiscal condition of Medicare. They won't be able to sustain it. And if it's not changed, payments will cost Medicare up to $600 billion between 2023 and 2031. So that's not a very encouraging outlook. Okay, they came back, another report in 2022. And they were reporting on the previous year, 2021. There were 27 million enrollments in Medicare Advantage programs, which is now 46% of the total in 2021. CMS paid $350 billion, and this was out saying what they paid for the Part D drug plans. Traditional Medicare beneficiaries subsidize all those additional benefits that Medicare Advantage participants get, because it's coming out of our tax dollars and the money that's coming out of our Social Security. That's the dollars that are going to subsidize these Advantage programs, where a lot of times you don't have to pay for those if you're in a Medicare Advantage program. And here's again their statement: CMS spends 4% more for Medicare enrollees than they would spend if they were in traditional Medicare. Private plans have never produced, they keep saying this year after year, and the quality bonus payments that they can get are applied to all enrollees, but does not meaningfully reflect the plan quality. So the quality measures really need to be looked at. They're not reporting on what they really should, especially if their report is going to determine that they get more money. And then the rebates are the additional benefits that they get from meeting below the benchmark. This is the savings, that a lot of that goes back to the insurance company. And because of the additional benefits, traditional Medicare really can't compete. You know, if you're out there looking at programs and you can see that these Advantage programs will give you membership in a fitness club, and they'll pay something towards your eyeglasses and hearing aids, then traditional Medicare can't compete with that. Okay, now here's history from a lot of different sources of overpayments. So the CMS itself estimated 10 billion per year from 2007 to 17. And you can see the other ones there. Now down about 2020, the Department of Justice is getting involved in this, and they're saying, hey, this is fraud, and we're going to start going after these insurance companies. And you can see what they were able to recover in 2021, 5.6 billion. But again, it's a drop in the bucket to what is being paid out to these plans. Okay, now, if you can just give me a minute, I was looking for another way to teach people about this. So this is what I call my chopped liver series. And there's just a few of them, but humor me. So this is two very healthy looking dancing seniors, and they say, what about me? Why are my Medicare tax dollars providing extra services to seniors with Medicare Advantage? I also have eyes and ears and teeth. I want these services now. I already paid for them. What am I? Chopped liver. Now here's the physician. And I think we're going to have a real problem with physician shortage in the near future, because some of them are really just getting fed up early about what's going on with the need to have all these extra people, you know, in billing in their practice and everything. But this is what how a physician feels. I am a well-trained physician. I know how long to spend with a patient. I know what tests to order, and I know the appropriate medication for my patients. I don't need insurance companies practicing medicine. Please give me back my profession. What am I? Chopped liver. And then here's, I really love this one. This is a healthcare lobbyist. As you can see, a very happy man with the devil behind him. There are 3,270 healthcare lobbyists in Washington, and they help Congress make decisions about Medicare. We are happy. We are rich. Last year, we spent $725 million lobbying Congress on behalf of pharmaceuticals, hospital chains, and healthcare insurance companies. Yes, seniors and physicians, you are chopped liver. And then this to me is the real sad one. This is from a nurse. And she says, I worked through COVID with inadequate supplies and staff. A friend was fired for complaining about safety issues. I don't know if I can go on. I feel like chopped liver. Okay, now what can be done about it? Well, if you don't like this also a lot of people are not aware of. If you go into a Medicare Advantage plan, you sort of have a grace year of the first 12 months to make a change back to traditional Medicare. And you can do that without any kind of financial penalty. And that means that the supplemental insurance company cannot refuse to give you a policy. So they have to give you a policy, and they can't do typical underwriting. So that means if you have pre-existing conditions, they cannot use that to charge you extra for these pre-existing conditions. But it only lasts for the first 12 months that you are in the Advantage program. Okay, in my opinion, our healthcare system is failed. It does not promote the general welfare. We have 30 million Americans uninsured, even more underinsured that have insurance but can't afford to use it because of deductibles and copays. We deliver poor healthcare outcomes. If you look how we compare to other advanced countries, we are not doing so well. We have high cost, high waste. We are driven, our system is driven by for-profit insurance companies, pharmaceutical companies, and hospital chains. And this system is unsustainable. So to me, the answer is improve Medicare for all. Both Representative Jayapal and Senator Sanders reintroduced their program this week. As you may know, our president is not in favor at this moment of supporting this. But also, I just wanted to say, some people say, oh, this is socialized medicine. We can't do it. But it isn't socialized medicine. The government will run health insurance. The government will not run healthcare. Health services will continue to be provided by independent physicians and hospitals. So to me, this is the answer, and we have to do something soon. And then I'd just like to end with the youngest generation of the McDevitt clan. And the reason I really am interested in this is because of them. They're going to grow up. I hope they have a profession, a happy life. And I don't want them to not be worried about their health care and not have Medicare to look to when they're 65. So thank you very much. I think that's it.
Okay, I think maybe you can stop sharing the screen.
Okay, let me see if I can do that.
We'll see who's left on here who might want to ask questions.
One for English.
Let's see. Stop share. Okay, stop share.
Okay, so people can unmute if they'd like and but don't speak all at once. I'll call on you when you ask a question. I want to ask something first that I've been confused about from day one with this insurance. I don't understand what the difference is between Medicare supplemental and Advantage. I don't get this terminology. What is?
Well, I have traditional Medicare and a supplemental insurance company so that they pay the 20% that Medicare won't pay. That's called traditional Medicare. Medicare Advantage is another whole system whereby Medicare works with for-profit insurance companies. They provide the program, and supposedly they were going to save Medicare a lot of money. And so they introduced their programs with all those provisions, all those copays, And so you make a decision when you're 65, do you want to go with traditional Medicare and a supplemental insurance policy? Now, some people, if they think they're very healthy, they might not get a supplemental insurance, but that leaves them at risk for that 20% that they have to pay when they get sick. Or do you want to go into a Medicare Advantage program, which in most cases is run by a for-profit insurance company? Does that help?
Yes, but Kaiser is not a for-profit company. So what is that called?
Okay, well, it's very interesting. Kaiser has been around a long, long time. It's considered an HMO, a health maintenance organization, which has a
I
membership
just wanted
and
to see if I
started
could go under one book.
by Kaiser a long time ago. But what you need to know about Kaiser is there's three parts of Kaiser. One is their insurance program, which is nonprofit, and their hospitals and clinics put together, which is a nonprofit entity. And then they have Kaiser Permanente, which is the organization of doctors. And guess what? They're for profit. In fact, they have made so much profit in the past. In 2007, they established Kaiser Permanente Ventures. They now invest in other healthcare companies. I think right now they invest in 65 healthcare companies. And just so that you know, they are not immune to doing upcoding. In fact, the Department of Justice is after them. There was a suit filed by 6 whistleblowers from Kaiser in Northern California. And that is going to be brought to trial, I think, by the end of the year. So they are doing as much upcoding and getting fraudulent payment from Medicare as any of the other Medicare Advantage programs.
That's shocking. They haven't upcoded me.
You don't know.
I
You
hardly
don't
pay-
know because you never see that.
Well, I don't go there very much, but you know,
Yeah.
I don't have copays for a lot of things. They give you free, you know, you get every year you get a free, what do they call it?
Mm.
And they just check you out every year.
You're
That's-
not one of their favorite patients then, Georgia.
Well, I don't know. They treat me nicely when I go
Oh,
in.
well, that's good. Yeah, I'm glad. Well, you
Yeah.
know, I have a lot of friends that belong to Kaiser. In fact, when I gave the presentation in Oakmont, I think half of them were Kaiser members up there. But I've heard some problems with the availability of specialty groups. I had 2 friends that had to go out of network to get dermatology services that they were happy with. And so, you know, I don't have anything against Kaiser's program of bringing doctors and specialty doctors and primary care together to provide services. I think that's very good. And the docs that are in it, most of them like it because they don't have to take care of all the administrative issues that they would in private practice. But they are as bad as any others in ripping off Medicare. So that was my complaint against Kaiser.
Shocking. Does anyone have some questions? Or are you too stunned to ask questions?
What am I going to ask?
Well, I don't know.
Linda?
Well, you know, I've heard Tom Hartman really goes down on Advantage, Medicare Advantage all the time, saying it's just such a ripoff. But like Rocky's getting good treatment at Hoag, and apparently just to get a doctor, he had to agree to Medicare Advantage. But I worry that if he somehow came down with some horrible cancer or something, they'd toss him out. This is what I hear, right?
Yeah, they do. First of all, they want to pick healthy ones. And when you get
Right.
sick, they try and discourage you to leave and go back to traditional Medicare. But
Right.
by that time, it's going to cost you a lot more money. Yeah.
Yeah. So he keeps saying, but it doesn't cost me anything. And I say, well, that's just because you're not sick enough, right?
Yeah. Yeah.
Yet. Okay, Ben wants to ask something.
Mm.
Ben? Ben, I called on you, but you're mute. Well, does anyone else want to ask something? I can't seem to get him to unmute. Jonathan? Go ahead.
Yeah, thank you. It looks like I just brought out my card and it says AARP Medicare Advantage Secure Horizons.
Yeah,
And
AARP, you know, that group, Association for Retired Persons, they sponsor that program, Secure Horizons. I believe that is, I don't know what insurance company runs that one though.
that's United Healthcare.
Okay, so it's one of United Healthcare. So where I'm in their traditional program with supplemental insurance, you're in their Secure Horizons Medicare Advantage program. Secure Horizons is a Medicare Advantage program. How do you like it?
Okay,
Are they taking good care of you?
well, I like being able to go to my GI doc, my primary care person, Curtis Robinson. So they're doing pretty well. The one area where I'm having to pay a lot is that every time I have to get an injection for Stelara,
Yeah,
I'm paying like $1,400 per shot.
no, that's a lot. Yeah, that's the
Yeah.
same thing I'm seeing with one of my friends that has rheumatoid arthritis. She has gone through 3 programs. One is SCAN, then she went to a United Healthcare program, and then back to SCAN, really to try and get a program that paid for her rheumatoid arthritis medicine. And then the 4th time she had to change was her primary care doctor left the program. So now she
Oh.
has to either go with her primary doc and leave that program or not. So she's having a lot of problems with trying to get her medication paid for.
Well, I'm finding a trade-off about my monthlies, because I have a high income, my monthlies are a little higher, but not as much as higher was before 65. But
Yeah.
when I was before 65, my Stelara was $50 per shot. Now
Oh,
they've switched. Now
Oh
they've
my God.
switched.
yeah. Well, they're going to get money out of you one way or the other.
So, okay.
How
Well,
often do you
then,
have- How often do you have to
Is it-
get those shots?
every 4 weeks.
So it's 1,300 a month.
That
Yeah, so,
adds up quickly.
Sure does.
Mm.
yeah, it does. So I'm wondering, my concern is try to get that cost down, or to probably go to Lord's and get some water and drink it and heal myself instantaneously so I don't have to have Crohn's.
Right.
So beyond that, I've just, I don't know if I was just wondering, is it a smart idea to get out of United Healthcare and go to something else, or what?
Well, if you want to sort of evaluate all the programs, you know what I showed on the screen for the basic under Kaiser, that was written up in 8 pages. So if you want to do investigation, you're going to have to print out all that or review it and every other program so that you know for sure what you're going to have to pay for the medicine. Probably easier
Right.
to call them up and tell them the medicine that you're on, and do you have a drug program within your Medicare Advantage that would help me pay for this medicine? I would ask them directly.
So ask who directly?
Well, if you go to, anyway, you just Google Medicare Advantage programs in Sonoma, California.
So he's in Marin.
Light, you'll find the list, and they also have phone numbers. You can just call them.
Okay, all right,
Now,
thank you.
You live right near Kaiser San Rafael, Jonathan. You should just check them out.
Well, I don't want to give up my docs to have to go to Kaiser. That's the
Oh.
trade-off.
Okay.
Yeah,
Yeah.
But it sounds like if it, I've been doing okay, I can afford it, but I would love to be able to get a much lower cost on that.
Mhm.
well, the other hopeful thing is, I forget what act it is under, but Medicare has finally gotten permission through, I don't know if it's the Reduction Act or one other, to start negotiating with the insurance companies for like 25 medications. That's the start. Before that, by law, they could not negotiate. The only people that could negotiate for medications with these pharmaceutical companies was the VA hospital. And if you think the VA hospital is really socialized medicine, the government owns the hospital, owns the doctors, employs the doctors, and owns the insurance companies. So they're the only ones up until now that have been able to negotiate better drug prices.
All right. Somebody just posted on the chat there's a high cap, and I don't know if Diana Lopez is still associated with them. Is she still associated with them?
I don't know. I can't tell you that, Jonathan.
Okay. All right. Well, she was, and so anyway, that's all I know about that. I don't know very much about it, but thanks for your help on this one, Mary. Pleasure to meet you.
Thank you.
Okay, Ben.
Yeah, it took me a while to figure out how to find the unmute button on the phone
Oh.
as opposed to a desktop. But yeah, I think it's interesting to me to people talking about the great lengths they have to go to patch together some kind of functional medical services for themselves. And I think I probably have been drawn in, Kaiser has been wildly successful in terms of their interface, their customer interface, at least with me.
Me too.
And my family is like, it's actually, I've had this discussion with Kaiser doctors before who say, actually the system that you've developed here, I mean, it's very user friendly. I just use the app. I speak directly to my doctor, when I need to via chat. I can make appointments online. I've had a few surgeries. They hit you with the fentanyl and you're happy. And next thing you know, you're out. So it feels like what a Medicare for all would be like. If I didn't have to think about the fact I'm paying money, Kaiser has lulled me into feeling like, oh, this is the future of medicine. And I think that the thing they have that distinguishes them as a model is that they are very deliberately, like their namesake, Wilhelm Kaiser, doing mass medicine. A lot of people, particularly this part of the world, they really can't resist the temptation to want to go into boutique medicine, where my special needs and my particular micro niche is represented. Kaiser is like, if you've seen the size of the buildings that they've created, the center in Santa Rosa, it's like giant. These things are built for the rest of the 21st century. They've got 2 city block sized buildings. They are prepared for the future. I could see that format being adopted quite readily by just taking out the Kaiser Permanente, group and nationalizing that thing. And it would be a great template.
Yeah, I think
well.
it's a good model for the delivery of care. And if we get Medicare for all, the only thing they would lose is the insurance program.
Right.
Yeah.
They could stay and go their happy way. But they are subject to this upcoding, and it'll be interesting to see how they respond to this False Claims Act that the Department of Justice is bringing against them.
Yeah. Any other questions, ideas?
I noticed that the National Nurses United Union just was citing apparently a precedent in law that's going to help press some of these lawsuits against Kaiser regarding mental health care. They seem to downgrade their capabilities in that area and don't really want to fund it. So there's been some people that wanted to, push back on that. There's been, the unions push back on that. There's been a bit of a strike and so forth. So do you know anything more about that and could speak to it?
No, well, I think part of the problem is there just aren't enough mental health providers that are needed. And I believe in something in the contract that they finally agreed to. They were going to start some education program for mental health workers, but I don't know if that has started or it's going to start. But, people are waiting months to try and get an appointment. And this is not just Kaiser, it's in any of these other programs. We just don't have enough practitioners to help all the people that need it.
Katie?
Yeah, I'm a mental health worker, psychotherapist, and so I guess first I want to comment, thank you so much, Mary. And I was going to comment on something you said really early on about, now I'm blocking it. Anyway, something about basically it's a sad state of affairs. But what I was going to add is, so I work with Sutter. Oh, here's what I was going to say. So I work with Sutter Health, and through their EAP, I take clients. So during pandemic, it was very traumatic work, but I've worked with them very efficiently as a therapist. But most places, Optum, Beacon, Blue Shield, all of the rest of them, even Kaiser, it's a horror show. All of my colleagues are just getting so spent, even filling out the application. I won't bore you with the details, but they require infinite information and they don't pay well. And I don't know if my experience is many of my colleagues are just simply not taking, they're not willing to work with these people because it's too complicated and it's too burdensome and it's exhausting. I mean, I could tell you pages of things that we have to fill out that are completely unnecessary, absolutely with regularity.
Yeah. Well, you know, this is another area that is pushing these young docs that go into the boutique medicine, you know, where they have people that can afford it, that pay them so much a month, and they don't have to deal with any of these things. But, you know, it's really hurting the medical profession. And I know in part of these lawsuits against Kaiser, the whistleblowers were saying that the doctors were being forced to put added diagnosis on the medical charts. And that's why now they're going after them under the False Claims Act. So, by Sutter Health, I worked for Sutter Health. When I was medical director at Marin, I was employed by Sutter Health because they had the management contract. And they were finally, their contract was not renewed because the docs and the people in the community felt that Sutter was taking all the money out of Marin and it was going up to Sacramento, which of course wasn't true, but that was okay. But if you'll remember, even Sutter Health was brought to task by our Secretary Becerra when he was, you know, Attorney General in California, with a big fine. And what they were doing is saying, okay, we'll do a contract with you, but then you can't send your patients to any other health system. And you have to make a contract with all our facilities, not just the ones in Marin or whatever. You have to have a contract with Amador County as well, which was an antitrust thing. That's what they had to pay 2 large fines because of their activities. This goes back about 3 years. Yeah. But I mean, you know, any healthcare organization has its good and bad points, but they're all doing this upcoding. And if we could just get that out of the system, we'd save a lot of money. And they're all doing it.
Well, there's a thing called the CAQH and the NPI, and people from India call me. I have to resurrect this very complicated technological program every 2 months, or I can't use them. It's really awful. It's called ProView Express.
Yeah. Is that a software program?
Yep.
You know, well, this upcoding has produced a new industry, software for upcoding. And then the other thing they do, they send nurses out to the home to see if they can document any kind of something that's another diagnosis so that they can put it on the bill. It's just terrible what's happening.
I mean, and so my last question is, Portugal any better?
I'm sorry, I don't know, unfortunately.
Europe is better generally.
Is
Yeah,
it?
generally.
Yeah, I mean, that's what I was gonna say to Jonathan if he's still on. You know, why not, if you're going to Europe, get some of the shots there? It's gonna be so much less expensive. It's incredible. Linda,
You may have answered this and it went right past me. How did they sneak this Advantage plan in under Medicare? It's so confusing, which is why so many people have it and they shouldn't. It's
it was
horrible.
privatizing part of Medicare, isn't that?
How
what-
did they?
Well, when they said they could save Medicare money. That was the whole thing that they were going to do. So please let us, private insurance, get into it because we will save you money. And as you can see, they have never done that.
Right.
So Medicare had to approve it. So they
Oh,
approached
yeah. It's
Medicare.
an approved part of Medicare.
Wow.
But again, I blame what's going on in Congress. Look at if every senator and representative has 2 or 3 lobbyists telling them about healthcare and what they have to do. And of course, they contribute to the campaigns of these people in Congress. So they're not going to come up with anything against them. It's a vicious cycle and it's going to ruin our healthcare system if it has not done so already.
Yeah, it's very deceiving. That's what gets me. People just
It's-
don't understand it.
Well, it privatized part of the system, which never should have happened.
Exactly. Yeah.
Does anyone else have anything? This has been a very instructive meeting and we've got it all recorded, so it's
Yeah.
great.
Well, thank you again for inviting me. I appreciate it.
Yeah.
I am working on another presentation, maybe sometime in the future, on private equity in healthcare. That's another issue I've gotten involved in, which is another disaster for healthcare, but maybe at another time.
Another time, and then hopefully we can work with the few senators who are really advocating for Medicare for all, and I'm not sure why we don't have it in California anyway.
Yeah.
Since the presentation was recorded, will you be able to email that out to everybody who
Yes,
participated?
if I've got your email or Mary can send it to you, Mary will get the link tonight.
Yeah,
And
that's great. Thank
Thank
you,
you.
Georgia.
Yeah, you will get it tonight. Mary, I want to thank you so much for doing this because this is the kind of information that I think all of our members would be interested in, and I'll make sure everybody gets a copy of it.
Yeah, okay. Well, thank you all.
Thank you, Mary.
Hey,
Thanks,
take
Mary.
care. Bye-bye.
Bye. Nice to see the rest of you creatures.
Oh, Georgia, I wanted to ask you, when will I get the one from yesterday? I'm sorry I couldn't be here.
Okay, the ones that have a